thank you for joining me. Tonight, I am bringing you a story that highlights the importance of vaccines and the challenges we face in maintaining public health. Measles, a disease once declared eliminated in the United States back in the year 2000, is making an alarming comeback. As of April 2025, measles outbreaks have been reported in 29 states, with hundreds of cases confirmed. What's behind this resurgence? The answer points to a concerning decline in vaccination rates. Stay with me as I explore how a preventable disease is reemerging, what this means for our communities, and what can be done to stop it. Let's start with a quick refresher. Measles is a highly contagious viral illness that spreads through the air when an infected person coughs or sneezes. It causes symptoms like high fever, cough, runny nose, and a red rash that usually spreads all over the body. In severe cases, measles can lead to pneumonia, brain swelling, and even death. The virus is so contagious that if one person has it, up to 90% of the people close to them who are not immune will also become infected. Measles is particularly dangerous for young children and those with compromised immune systems. According to the World Health Organization, in 2021 alone, there were over 128,000 global deaths from measles, mostly in children under 5 years old. While the United States has historically had strong vaccination coverage, this safety net is slipping. Fortunately, the measles, mumps, rubella vaccine, or MMR vaccine, has been highly effective. Just 2 doses provide about 97% protection against the disease. The first dose is typically given at 12 to 15 months of age, and the second between ages 4 and 6. Measles was declared eliminated from the United States in 2000 thanks to widespread vaccination efforts, meaning it was no longer consistently transmitted within the country. However, declining vaccine uptake and increased international travel have allowed the virus to re-enter the country and spread. Let's take a look at what it actually looks like once you're infected with the measles. According to the Centers for Disease Control and Prevention, the United States has seen 884 confirmed measles cases in just the first few months of 2025. These cases span 29 different states. The resurgence has been the most severe in states with lower vaccination rates. Texas has emerged as the epicenter of the current outbreak, with 646 confirmed cases, nearly 73% of all U.S. cases so far this year. Alarmingly, 393 of these cases have been concentrated in Gaines County alone, a region where MMR vaccination rates have dropped below 85%. Other hotspots include Ohio, New York, and Florida, each reporting over 30 cases and experiencing localized school closures and quarantine efforts. Public health officials warn that unless vaccination rates improve, these numbers are likely to rise through the summer travel season. What's even more alarming is that 97% of these cases involve people who were unvaccinated or whose vaccination status is unknown. These numbers show a direct correlation between low vaccine coverage and the return of measles. The disease is no longer something we read about in history books. It's here, it's now, and it's spreading. Why is this resurgence happening? A key driver is the declining vaccination coverage across the United States, particularly among young school-aged children. According to the Centers for Disease Control and Prevention, national coverage for the measles, mumps, and rubella vaccine among kindergartners dropped from 95.2% during the 2019 to 2020 school year to just 92.7% in the 2023-2024 school year. While this decline might appear small, it's very significant. Measles requires a very high level of community immunity, around 95%, to prevent sustained outbreaks. This is due to its extreme contagiousness, with a basic reproduction number ranging from 12 to 18, meaning each infected person can potentially spread the virus to up to 18 others in a fully susceptible population. When vaccination rates fall below the herd immunity threshold, pockets of unvaccinated individuals can become breeding grounds for outbreaks, especially in communities with philosophical or religious exemptions to school immunization requirements. Recent data show that these declines are not uniform across the country. Some states, like Idaho, Texas, and Utah, have kindergarten MMR coverage rates below 90%, leaving large groups vulnerable. The CDC also notes a rise in vaccine exemptions. In the 2022-2023 school year, over 3% of kindergartners were reported as exempt from one or more vaccines, the highest rate ever recorded in the United States. This drop in protection, combined with increased global travel and growing misinformation about vaccine safety, has created the perfect conditions for the return of a disease the U.S. once declared in the year 2000. To help understand this better, I interviewed Dr. Smith, a pediatrician at a local health clinic. Dr. Smith, can you tell us what trends you're seeing when it comes to childhood vaccinations?
Every year, we see more families delaying or skipping vaccines due to misinformation. Some parents are unsure, others believe false claims they see online. The result is more children left vulnerable, and that puts entire communities at risk.
How serious is the impact of these delayed or skipped vaccines?
It's really concerning because of many diseases, like measles or whooping cough, were almost eradicated thanks to vaccines. Now we're seeing outbreaks again that simply shouldn't be happening. Even a small drop in vaccination rates can lead to major outbreaks.
What are some of the main reasons parents give for hesitating or refusing vaccines?
I spend a lot of my time during appointments answering questions and addressing fears. I understand where the parents are coming from. They just want to protect their kids. But unfortunately, a lot of information they find on social media or certain websites isn't based on science. It's emotional, it's persuasive, and it's wrong.
Can you explain why it's important for the broader community that individuals stay up to date with vaccines?
Yes, of course. Public health depends on something we call herd immunity, which means a high percentage of the community needs to be vaccinated to protect those who can't be, like newborns or kids with medical conditions. When vaccination rates drop, we lose that protection, and vulnerable people are exposed to serious preventable diseases.
What is your clinic doing to help fight misinformation and encourage vaccination?
We try to combat misinformation by offering clear, evidence-based education, hosting community talks, and working with schools to get accurate information to families. It's a slow process, but rebuilding trust is key. I always tell parents, if you have doubts, come to us. Talk to a trusted healthcare provider before making any decisions based on something you read online.
Thank you so much for speaking with me and educating our viewers. A recent poll found that more than half of US adults have encountered false claims about the MMR vaccine. These include myths about vaccines causing autism, a theory that has been thoroughly debunked, and claims that natural immunity is better. Social media platforms have also become a breeding ground for vaccine misinformation. And it's not just the internet. Mixed messages from public officials and inconsistent policies across states have added to the confusion. When public health messaging is unclear or conflicting, trust erodes. And without trust, even the most effective health measures can fail. This resurgence doesn't affect everyone equally. Some of the most vulnerable include infants too young to be vaccinated, people with weakened immune systems, and those who can't be vaccinated for medical reasons. A recent study published in The Lancet Global Health warned us that if current vaccination trends continue, the United States could experience millions of measles cases over the next 25 years. Specifically, projections estimate that declining immunization could result in over 3.5 million measles cases, leading to about 50,000 hospitalizations, 5,000 cases of long-term complications such as brain swelling, and close to 1,500 preventable deaths. The public health costs of these outbreaks would be staggering, not just in terms of human suffering, but also financially. Estimates suggest that each measles hospitalization costs about $10,000 to $20,000 per patient, not including costs from contact tracing, outbreak management, lost productivity, and long-term care for survivors with disabilities. A single large outbreak, like the one in 2019 linked to New York, cost local public health departments over $8 million to contain. Also, it is important to remember, measles is not just a childhood disease. Adults who were never vaccinated or who have weakened immune systems are also at high risk of severe outcomes. The good news is we have the tools to prevent this in the future. However, sustaining it requires continuous investment in education, public trust, and action. Combating vaccine misinformation, making vaccines accessible to all communities, and reinforcing the importance of herd immunity are critical steps. Public health is not just about protecting yourself. It's about protecting everyone around you, especially those who are too young or are medically unable to be vaccinated. So, what can we do? First, get vaccinated and encourage others around you to do the same. Second, rely on trusted sources like the CDC and your local health department for information. And third, speak up against misinformation. Measles is entirely preventable. The return of this disease is a symptom of something bigger, how misinformation and complacency can unravel decades of public health progress. It shows us how quickly hard-won victories can slip away when we lower our guard. Vaccines are one of the greatest tools we have to protect not just individuals, but entire communities. Let's not allow fear and false information to erase the progress we have made. Let's change that. Let's protect our communities, starting with honest conversations, trusted science, and a shared commitment to public health. Thank you for watching. Stay safe, stay informed, and most importantly, stay healthy.